Cindy Whetzel, and our group chose Article 7, Schoolwide Intervention to Reduce Chronic Tardiness at the middle and high school levels. My responsibility was to do the how part of the article critique on each of the 7 components. The authors began with an overview of the effects of chronic tardiness in schools. Data shows that chronic tardiness significantly reduces the amount of instruction time for all students. This has led to the development of programs to provide positive behavior support interventions in a school-wide setting. The basic components of a PBS include gathering data, finding an intervention plan. This article focused on the Start on Time program, training for teachers and students, and implementation of the program. The article critiqued the Start on Time program that was used by a tribal school in Washington State. The authors included the demographics of the school and presented the procedures used to develop the program. First, they gathered data on the number of daily tardies. Second, they chose the program they felt best fit their school, which was the Start on Time program. Third, they set the school-wide plan, which included the guidelines for consequences for those who were tardy to class. Fourth, they developed the implementation plan. This included teacher training and student training. Finally, they agreed to fully implement the program after 2 months of evaluation and training, and to continue gathering data in the subsequent months. The authors then reported the findings of the program implementation. They offered an evaluation on the positives of the program, which did show a reduction in daily tardies, and provided suggestions for better implementation of the program, such as providing positive instead of negative consequences.
I'm Elaine Vallery. My responsibilities for this paper were to read and critique the how well sections for summary, needs met by the program, and program description, and also to compile the paper. In the summary discussion, the authors did a good job of covering 6 out of 7 of the points, which was summary, description of the context of the evaluation, description of the program participants, justification of the criteria selected, description of the data gathering procedures, description of the findings. But when it came to the last one, which is recommendations, they instead discussed lessons learned and cautions and concerns. They did do a good job where the textbook talked about they should use headings and subheadings to make it easier to read. The next section, needs met by the program. They talked about what the need was. They identified the need, and they did an excellent job of identifying what the need was, and that was to get the schools to get the kids to class on time without loss of instructional time. They also were very explicit in discussing what the problem was, which was tardies, and how often they happened on a daily basis. They did a good job of explaining how the START helped the school. In the third section that I had, which was program description, again, they were very good in discussing what the program was and what it would do for them. They also provided a sample plan that they followed, and this plan was easy to understand and would help other schools implement one like it.
Hi, I'm Andrea Phillips. My part in this project was to analyze how well the authors addressed evaluation questions and evaluation design. I turned to our textbook after having read the article for help identifying the program evaluation questions and real-life examples on evaluating a program. In our paper, I address all 4 of the main questions as well as those that fall under them. For the purpose of our video, I'm going to condense my findings by saying that the authors of the article did adequately address the evaluation questions with the information that was available to them. In looking at how well the authors addressed evaluation design, I again looked to our textbook. The authors of the article, again, they did the best they could with the information given. It does not appear that evaluation design was discussed prior to program implementation by those who designed it, as is the best practice.
Hi, my name is Jennifer Wigal, and my responsibilities in this project were to address the how well sections of evaluation findings, conclusions, and implications. Overall, the findings were that with this program in place, tardies decreased substantially. However, they did find a need to modify the plan to help increase instructional time, which had not increased as they had hoped. Future research was suggested, as this study was a contribution to an area lacking comparable studies. Overall, they were on target in their evaluation findings and program suggestions.